Hello everyone, welcome. My name is Dr. Alex Milspaw and I'm about to be joined by Monique, our new nutritionist, and she is phenomenal. I'm really excited for you to meet her. She's put together a really amazing program for chronic pelvic pain patients on nutrition, and she does cooking demonstrations, and she just knows so much about the brain-gut connection, and I'm just really excited for our conversation today and for her to share with you everything that the programs that she's putting together and how the two of us are really working together here at PRM. So let me get her to join us here.
Hello!
Monique! So I just did a brief introduction to you while we were connecting here, but really excited that you're on board here at PRM and that we're going to be working together for the wellness program. So yes, who are you? And tell us what you're going to be doing.
Yes, well, I'm super excited to be here. Hello, everybody. So I am the Director of Integrative Nutrition and Health Coaching for Pelvic Rehabilitation Medicine, and I'm here to help everybody talk about their health and wellness, and I've created an online program that starts in just a couple of weeks. So it's a nutrition forward course that also, looks at all aspects of your life, right? And that's where behavioral health comes in too, because we can look at the food, but there's also so many other things to consider in addition to the food. But I really believe that we can heal our bodies. And the vessel I choose to help people heal is through food. And it's really just helping people learn to crowd out the foods that aren't helpful in healing your body, and then bringing in all those nourishing foods that are really going to have a big impact and really just start to nourish you, right? So the program is called Nourishing Foods to Help You Heal Your Pelvic Pain. So we are going to dive in for 6 weeks. So I hope that all of you will join us. It's going to be, again, it starts Monday on March 25th from 6 to 7 p.m. for 6 weeks. And there's just a lot of information that I want to share with people, again, to help them heal their pelvic pain and reduce their symptoms.
Yes, and I love, the way you put together the program is really holistic in nature, even though you're focusing on certainly the brain-gut connection and teaching them about the foods and what heals, what doesn't heal, what can get in their way. The way you framed it is such an empowering way, right? You're pointing out that how much power each person has over their own healing and well-being, and you're also recognizing how hard it is to change diets and to learn how to cook differently. And I know one of the things you're doing in the class is some of the cooking demonstrations.
Yes.
That's what I'm looking forward to.
Yes, I forgot. I already forgot about that part. Yes, that's my favorite thing to do I can tell people all day long, eat this, here's this recipe, but I love showing people, because then it's like, oh, wow, yeah, hey, that is easy. Like, in theory, things look easy on paper, but when we see it done, it's like, I could do that. So I'm really excited to share a few of my really, healing recipes with you. A lot of them, well, all of them I include in my own life. So I definitely always practice what I preach, because I really believe that food is medicine, or that it can be a really slow form of poison. So yes, I'm super excited about the recipe demonstration. Thank you for mentioning that.
Yes, and again, I remember one of the first times I saw a cooking demonstration, it was not only how easy it was, but how quick you were able to make the meal, right? Sometimes people can really, such as myself, where I was like, okay, if I'm going to make this meal, it's going to take an hour, it's going to take 2 hours, and I don't have that time.
Right.
Working full-time mom, full-time everything, right? We just don't have the time. And I remember one of the little videos I watched for you, I was like, oh, that only took her maybe 10 minutes, and she's done, and even cleanup was easy. So it's a time factor that you bring into the course, as well as the ease, and again, the mental health piece, or the behavioral health piece, or the emotional health piece, however you want to call it, but that sense of talking to them about the relationship that they have with food, right? What does food represent for them? And that's what I talk a lot with people in terms of, understanding it is part one, but then part B is really emotionally preparing ourselves to not have what we're used to, right? That sense of emotional anchoring of, okay, when I'm upset, this is the food that helps me feel better. Or even that sense of feeling full is almost like an internal hug. And I remember the nutritionist that I worked with 20 years ago said, look, the hardest part about getting away from gluten or getting away from some of these inflammatory foods is that you're not going to feel that bloated feeling that your brain associates with fullness. And
Right.
separating out those terms of, do you feel satisfied or are you waiting to feel full? And full is actually not a healthy sensation.
Right.
But having that warning, having that heads up of, okay, I'm not gonna feel bloated, but I'm gonna feel satisfied. Can I start to tune into my body about what the difference that is?
Yes, exactly. And so that's what I help teach as well is how does food make you feel? And I've had a lot of clients in the past say, once I started to change the way I eat, I realized that when I eat the food that I was used to eating, I wouldn't feel as good. And I just thought, oh, you're just supposed to feel bad after you eat all the time. You're always supposed to feel bloated. No, you don't need to feel that way, right? So so one thing I recommend is that everybody keeps a food journal throughout the course so that they can, pay attention to how different foods make them feel. Because by the end, you'll notice it's like, oh my gosh, wow, like actually I'm feeling a lot better eating these other things. And then you also touched on something really important. I don't believe in quitting any food cold turkey. And I know a lot of people are used to dieting. It's like, get rid of this and just eat this. It's like, no, because like you said, there's an emotional component to a lot of food. So it's like, I want to eat that food that gives me a hug, that makes me feel nostalgic, that reminds me of when I was a little kid. But it's like, sometimes that food isn't helpful in our healing process. So then what can we eat instead that's going to provide that same feeling and satisfaction and the comfort? So I call these foods transition foods. So there absolutely are plenty of packaged, more convenient foods that you can include. I call them tools, because any packaged foods are not a replacement for whole foods, and we definitely want to be getting some home cooked meals in there if we can. But there's packaged foods out there that help you transition from whatever it is that's not helpful in your healing to something that's giving you that comfort still. And then maybe that's something that it can be a healthy part of your diet, right? Like crackers that are, grain-free and gluten-free, but super crunchy and salty. And, yes, you can have your crackers and hummus, but I'm going to ask you to throw in some cucumbers and carrots and eat those with crackers, right? It's like, instead, again, going back to the crowding out, instead of, focusing on what we're getting rid of, let's focus on what we can bring in. So.
Yes, and the combinations, right? Because again, knowledge is power, and I remember learning. Okay, if the Lyme, right? If someone that has Lyme's disease, and someone said to me, well, you don't want to feed the Lyme. You don't take care of the Lyme, take care of you. And if you're having that starburst or those Skittles out of the Easter basket, you're feeding the Lyme, so of course you're going to flare. And it was easier for me to think about not like starving the Lyme rather than starving myself, right? Because
Yes.
So hard for so many people to take care of themselves, and while they're doing that work, particularly with pelvic and sexual pain, they feel like they're doing so much already, right? They have their PT appointment, they have their PRM appointment, they have their therapist appointment, they have the nutritionist appointment, and it can feel like so much to do at the same time. And so really, helping them say, let's just understand what it is and how can we think about it differently. Gives them still that power of choice, but it's an informed consent choice rather than, oh, I didn't know. Something I see is they'll say, okay, I didn't do gluten or dairy, but I then only started eating nuts, or I only started eating this, and now their body has a sensitivity to that. And so it's that concept of everything in moderation, but also the combination, right? Eggs, if we're not, I know for me it's really hard to not do eggs, but we know how inflammatory that can be. But then it's, hey, add vegetables.
Yes.
All of a sudden it doesn't have that inflammatory reaction. And I know your program goes through that of not just what you can take out, but how can you do it to make it less inflammatory rather than feeling like you have to take it out completely.
Right. Exactly.
Yeah.
Yes, exactly. It's like, keep bringing in the nourishment, because really what, I don't know if people realize it, but when you have these kind of symptoms that, you know, that you're dealing with, the pelvic symptoms, there's an underlying malnourishment. Our cells are not getting the nourishment that they need. And a lot of times they're not getting hydrated the way that they need. So again, like exactly what you're saying, is focusing on, yeah, we got to get rid of a couple things, but it's like, no, let's focus on all the things that we need to bring in that are going to support you and really nourish you at a cellular level. And I love what you said about, like, yeah, don't feed the line, because it is that we have pathogens in our body, and, you know, especially when we're dealing with endobelly, right? It's like there's more of the harmful pathogens that are in there versus the helpful. So it's like, let's bring in more foods that are going to not feed the unhelpful ones, but feed the helpful ones. That's going to help us heal and feel better. So
yes. Yeah, and your program really does that. I mean, it helps make it visible, right? Some people are auditory learners, some people are visual learners, and so they're getting both of that through the program in terms of the handouts that you have and audibly hearing what you're saying during the course. But then you're also providing visuals as far as, again, A plus B equals C. Mm-hmm. But, you know, if people that are visual learners can say, okay, I don't want to feed the endo. I don't want to fertilize the endo, right? And then grow more. If I'm eating a lot of these types of foods, that's going to make it grow. And I don't want to fertilize that. I want to fertilize this. And, you know, similar to how I talk to people about the garden of their mind, right? We can't control some of these thoughts or these beliefs that have been planted in our garden over time through a variety of different people that plant things in the garden of our mind. But
right.
whether taking care of it or not, you know, versus planting something else. So the metaphorical things that you have both in the handouts as well as in the way that you teach is just really bridge what I teach in the Retrain Your Pelvic Pain course. It's how all the different ways that we can try to help deliver the same information. And so I'm really looking forward to taking the course, and I really hope people sign up for it too.
Yes, well, and yours is coming back around in just next week, right? It's starting up again?
Yes, yep, that's right. And so I talk a little bit about the brain-gut connection, and I know you cover that as well, and you're going to go more into depth about how to heal the gut. But one of the main things we see, particularly with IBS, is if there's constipation, which is common with endometriosis, then you've got more sense of a depression, brain-wise, the brain responds with depression. And if there's an overactive bowel, right, with as far as diarrhea or frequency, you tend to have more anxiety. And when people learn that, it again helps them see their mental health differently, right? It's not they don't over-identify with their diagnosis of depression or anxiety, and they do see it as more of kind of collateral damage, right? It's like, okay, so all the activation, the overactivation and the inflammation that's happening both in the gut as well as the pelvis, if they have endo, right, that, you know, the brain is kind of collateral damage to that. And so if there's inflammation here, there's going to be inflammation here, and how that plays out. And again, that gives people more of a kinesthetic or a concrete way of regaining their sense of power over their mental health, because it's not saying this abstract concept of, oh, I've had a history of anxiety and depression, and do I have to take a pill for that? And as you say in your course, no, food is medicine or food is poison. And so if we want more depression and anxiety, keep eating those foods. But if you want to use food as medicine, which is one of the best things, you know, who was the first person that said that? Was that Hippocrates?
Yeah, they say, people argue that it wasn't him, but that's what I go with.
Whoever, lots of people have said it at this point.
Yeah.
But food truly is medicine, and I think we're seeing that more and more going mainstream. It used to be a hippie thing to think about, of only getting organic or only getting this or that. But I even had a patient recently talk about the drastic difference she felt in her body just going to Europe and being able to eat all these different, say breads and things over there, but not having a reaction, and then coming back and all of a sudden she has a reaction, and the difference in how, wheat, as this example, is processed differently. And people, sometimes it's hard for the brain to really understand that unless the brain is finicky. Unless there's a really clear cause and effect, it's hard for the brain to make that association. And I think people have that struggle with doing the anti-inflammatory diet, because it can sometimes take long for the gut. It takes about 3 weeks for the gut to heal. Actually, that's pretty fast in healing time. But to go gluten-free, 3 weeks feels like an eternity, but it can take that long for the gut to heal. And so I commonly hear, well, I've been doing that diet for 2 or 3 weeks and my pain isn't any different. So therefore it must not be working, right? So how do you explain that to the people that you work with?
Yeah. So I always explain to people, so think about how long it took you to get where you're at, right? It didn't happen in 3 weeks, okay? So as we start to shift the diet to more helpful foods, there's going to be what I call healing reactions or flares, right? Healing reaction to me feels better than calling it a flare, but really it's like, what's going on? Things are getting more intense, but it's because all of the healing food is going in there, and it's just like, if you think about like soldiers going to war, that's what's happening. They're just going in there and they're pushing out all the toxicity and pushing out anything that's not supposed to be in there, right? And they're really just powerful. And people think like, how can fruits and vegetables be so powerful? It's like, we've just gotten away from knowing the truth, right? Because it's all of a sudden it was like, oh my gosh, all this other food and packages is so much quicker and easier and fun. And we've just gotten away from like, how it was a long time ago before we ever had all the convenient stuff. But yeah, I just really feel like understanding, really internalizing that like it's not a magic pill changing your diet, right? It takes a while, and you will experience undesirable symptoms because it's just everything getting moved around in there. And I always describe, I even describe this in part of my program, why do some people feel discomfort when they eat a salad? And it's because I think of it as like the lettuce and the raw vegetables, they're going in there and they're like sweeping up all the mucky muck, and then it's like they're coming in with the brooms and all of the, the mop, and it's just like, but think about it, if your system is inflamed, if you have IBS or severe constipation or any kind of digestive issue, your intestinal lining is on fire, right? So it's like, it's sensitive. There's the nerves in there are gonna be triggered so that, you might feel pain and think, oh, that salad I ate, it's not digesting, but it's actually cleaning up all of the toxicity. So it's like, if you could, and I'll talk about in the course all kinds of ways you can get around that experience, because it doesn't need to be painful. It's like, oh, wow, raw vegetables aren't for you right now. Let's talk about how you get that same amount in a different way so that you don't experience those symptoms. But yes, I love what you're saying.
Point that you're making too, because I it's very similar with emotional and mental healing, where I say it's like a bell curve. Particularly when I'm teaching someone, say, the tapping technique, they say, well, I started tapping and then I felt worse, so it must not be working. Or as you're saying, right, I started eating healthy for a week or two, but I felt worse, so it must not work. But it's needing to help them understand it. It's like, actually, that tells me that it is working, right? Tapping and you start to feel worse, that means I'm helping your brain process what's going on, and so it feels safer to get to those deeper hurts, those deeper beliefs that really need to be neutralized. And I say, trust the bell curve. It's going to get a little bit more intense, but keep tapping, and all of a sudden you're going to feel this relief within, usually 5 to 10 minutes. And it's the same thing with this diet, right? People tend to feel worse because they're having, if it's really bad, it's called like the Herxheimer reaction, right? Where
yes.
Quickly, and all of a sudden they're flaring. It's like, no, just flush it, drink water.
Yes.
But if they know to expect that, it doesn't have to be scary, because fear can how the body responds to detoxes.
Right. And then when the fear comes in, it's like, then the symptoms get even worse. So it's just trusting your body, understanding that it's doing what it needs to do, even if it's unpleasant, but also trusting that, like, hey, I'm not feeling too good. Could it have been that smoothie I had? Well, what did you eat the day before? Sometimes it's like, oh, well, I had McDonald's for dinner. And it's like, okay, well, that could be moving through your system and causing problems too. Let's not blame the fruits and vegetables right off the bat. So that's also something to consider as you're shifting your diet. If you're still including, some unhelpful foods in there, then just know that, like, you're going to kind of have a, what's it called? Kind of like a seesaw, a yo-yo effect, right? In how you feel, right? So for for me, I feel like it's not about being perfect with what you eat. It's about being consistently eating well over time. Like, you know, diet culture has really just, you know, damaged us all, right? In you know, the calorie counting and the carb counting, but you don't have to do any of that if you're eating foods that make your own particular body feel good. And, you know, like what, you know, as you know, what works for me may not work for you, and vice versa. So it's like there's no one diet that fits all. That's why it's like, oh, my friend did great on keto, but like it was awful for me. It's like, yeah, because each person's diet or each person's body is unique and needs different foods at different times in their lives. So even just like what, you know, like what I ate last year is different than what I'm eating right now to support my body, right? And it becomes an intuitive experience where you're really feeling into, you know, what kind of nourishing foods does my body need? And then like what kind of comfort am I needing right now? And can I get it from something else other than food, right?
Yes, hugely. So that bridging that connection, which as you were saying, the longer term kind of food diary can help with, where it's practicing that intuition, practicing that mind body connection of really tuning in and saying, what am I really craving? Right. You know, it's like, oh, I want this. Well, what am I really wanting? Right. I talk to people about the door. There's a door that's labeled something, and then it's whatever's on the other side of that door is what we want, but what our brain thinks we want is the door, right? So it's like people want sex. Okay, well, what do you want actually that you think sex is going to lead to? Or I want a bagel with cream cheese. Okay, well, what are you actually wanting? I'm craving energy. I'm craving something smooth and creamy. I'm craving texture. I'm craving, you know, what is that? And to really slow that down, which mindfulness helps create that bridge for it, kind of saying what to tune into, not just that immediate perspective of what kind of the first impression of what the brain thinks we want, but if we pause just a little bit longer, all of a sudden something else comes up. And I think pausing too before people, as far as mindful eating goes, because certainly the state of the nervous system when we eat something really filters how the body receives it. So can you talk a little bit about your experience and how do you talk to people about mindful eating and kind of the emotional state that they're in when they eat?
Absolutely. I tell people, I say, look, if you're stressed out to the max, or, you know, you're eating when you're really anxious or upset. I mean, it could be kale. You could be just eating salads when that's going on, but those salads aren't going to serve you because like energetically you're swallowing this angst, right? Like this. So it's almost better to not eat when you're feeling really intense emotions, right? And to, you know, do the mindful practices, like do a tapping exercise, do some deep breathing practices, you know, especially if you know that you are hungry, but then, you know, like sometimes we're getting ready to make dinner and we might have a fight with somebody. It's better to, you know, calm your body down before putting food in it, even if it's like healthy food, right? Because I tell people you can eat all the kale you want, but if you're not managing, you know, dealing with your stress or difficult feelings, if you're not doing self-care, it doesn't matter what you're eating.
Yes. And I love that you brought in the concept of the environment. A lot of people can have trauma around the dinner table, right? We see that in the show, The Yellowstone, right? The dinner table is kind of this main representation of trauma, and the one character can't finish a whole meal even at the table. But this concept of sitting at a table could bring up trauma for people, or being even thinking about eating sometimes, right? If there's an emotional stress or emotional trauma around eating, they might intentionally distract or dissociate while they're eating, so they're not thinking about it. But again, they're subconsciously they're still in that angst place. And I remember having a conversation with a client that said, Alex, I know, but I really cannot take a lunch break. I can't afford to take a lunch break. And so I said, okay, well, how about, she had a swivel chair, and I knew that, here's all the computer screens she was working with, but this over here, she had this beautiful, huge picture of her family that helped her feel happy. So I said, okay, when you take a bite, I want you to swivel, look at your family, take a breath, and chew and swallow, and then turn to the computer, right? Just to have even just a moment of that mindfulness where she's trying to shift gears in her head and her nervous system prior to eating, because, you know, it's kind of really having to be creative with clients. It says, how are we going to work with your schedule, but how are you going to really help work with your body, right? You're not at war with your body. Your body just needs your help. You need to work with it, but we've got to get creative, because someone sitting for 10 minutes and doing a mindfulness practice before eating is, well, unrealistic for a lot of people.
Yeah.
How to sprinkle that in, how to sprinkle in that intentionality.
Hey. Well, as you know, even just like 1 or 2 minutes, like just one round of box breathing, like it's, so it doesn't, I mean, I think we tend to think like, at least like when I first discovered meditation, I'm like, oh, like, oh my gosh, like 20 minutes or 10 minutes, that seems so long. But it's like, some days it's like, oh, I'm just going to listen to this 5-minute meditation, or I've got 3 minutes. I'm just going to breathe for a little bit. So, and I feel like even just approaching food that way, right, too, instead of just like, oh my God, I've got to get rid of all these things, or I need to add in all these things. No, not all at once. Let's not, just pick one step at a time, because, you know, you might remove dairy, but then like, and maybe you do eat a bagel and cream cheese for breakfast, but it's like, oh, but now it's like, okay, now I'm having my bagel with avocado, and then I'm, you know, including like I'm having some fruit, or, you know, so it's just making small changes at once, and then you keep little tweaks, little baby steps to get you to where you want to go. And then you'll see how these little steps, just like what you're saying with all of the mindfulness practices, having the mindful eating, and really chunking it down, right? So it's that analogy, oh, I can't possibly paint the whole house, but it's like, you can if you start in one room with the door and one, and then so on, right? And eventually you're going to paint the whole house. So I used to use the analogy like eat the whole pizza, but I just felt like that may not work here, because some of us maybe can eat the whole pizza, but anyway, but it's just taking like small bitefuls, right? Small steps towards making the changes, so it's not overwhelming. So I really love the example that you gave, where it's just like, okay, if you can't take a lunch, let's just like start incorporating like how we can just get you to take small breaks. And I don't know, you'll have to tell me. Hopefully eventually she was like, I'm taking a half hour.
Well, that's exactly what happens, right? So when people start to say, okay, I'm just take 60 seconds every hour to do long exhalations, or to do humming, right? Just to calm the vagus nerve. And, you know, again, knowledge is power. So when people, I find that when people really understand what they're doing and why, they tend to be more likely to do it. But then again, it's time, right? So every time I say, okay, 60 seconds every hour, and if you do it every 10 hours, you know, for 10 hours, then you've got your 10 minutes of mindfulness. Great. But almost every time within a week or two, people are like, you know, that started feeling so good. So then I gave myself 5 minutes, and then I realized I was able to actually get more done. So then I did 10 minutes, and oh my gosh, now I'm leaving work early because I'm more efficient and more effective. I said, yes.
Works.
But then you have certainly the personalities where they're either all in or all out, right? They're like, nope, I can't do little tweaks, or it's just not going to work. I have to do everything at once. And that's when, again, what your program covers, and what I try to do similarly with the mindfulness and the Retrain Your Pelvic Pain course, is what are the substitutes, right? So it's not that you're depriving yourself of all of this and let's grin and bear it for 3 weeks until the gut heals. It's what are the substitutes, so you're still fulfilling the perceived and the real need that your body and your mind and your spirit are really craving. So that way you then don't binge, right? If we kind of all of the extremes, the risk of the extreme is the pendulum can swing the other way. But if we're putting these safety blocks in place of here's what we're substituting, here's what we're tuning into, and here's how we're rewarding the brain, you know, talking about how habits are formed and strengthened in the brain in terms of, you know, if we're having this delayed reward, most people that have been born in the past 20, 30 years are not used to delayed gratification. They're used to immediate gratification. And so we have to work with how their brains have been programmed. And so, you know, thinking about what does that reward, is that reward emotional for them? Is it energy? Is it, again, kind of sometimes it's texture, but, you know, bringing all the different pieces of the emotional aspect, the environmental aspect, right? What's in your environment? What's the emotional and energetic and nervous system environment that the food's going into? And again, more so the more we can help them understand what's going on and what they can do about it in a sustainable way, helps it feel sustainable. And that's, you know, again, with pelvic and sexual pain, there's so many different layers to it that it's easily overwhelming. And working with the patient of, are they the small tweaks for big changes type of person, or are they the all or nothing type of person, and helping them understand we can do either one, both can create healing, but let's see, it's going to require different changes for sustainability.
Yes, everybody's different with how they make changes in their life, but I just want to remind everybody, you just one small change, like even if you do either of our programs and you just get one thing from it, and like it's going to have a ripple effect throughout your life. So it's, you know, then because it can feel overwhelming at first when you're trying to change anything. So it's like, we're going to throw a lot of information at you, but I always just say to take what calls to you in the moment and leave the rest. Right. And maybe you just leave the rest for later. Maybe it's like you took notes and 6 months later, you're just like, wow, I really got, you know, I'm really feeling good. Let me go back and, oh, wow. Yeah, I remember that. I'm going to try incorporating that now. So sometimes we get, you know, seeds are planted with us, but we don't water them till much later. So.
Yeah. Absolutely. So we have a question about, you know, the Mediterranean diet specifically, and is that helpful for pelvic pain or pelvic floor? And I think I'll overlap that with the question in terms of when we're thinking about specific diets, as you already said, it really kind of depends on the person, and I think it really depends on their ethnicity and both, as well as generational type of programming and brain mapping, and I could spend a whole hour on that. But I think sometimes thinking of it in terms of a Mediterranean diet, or even right, I remember thinking of like a Latino diet or a Thai diet, right? Some of these different, if we think of it in terms of ethnicity, it's sometimes easier for people to think about recipes versus specific foods. I know it was for me, right? And saying, okay, I remember living in Costa Rica for a while, and it was, you know, okay, if I think about eating a Costa Rican diet, almost all vegetarian, gluten-free, you know, but it has a lot of corn, right? So when you're talking about specific diets for people, I mean, certainly there's no one size fits all, but how do you determine how to frame it, I guess, for different people?
That is a really good question. So I think it's important for everybody to understand that there's over 100 different diet theories out there. So Mediterranean diet is just another diet theory, right? Whole30 is a diet theory. Keto is a diet theory, right? It's like paleo diet. It's a diet theory. These are all theories that have, or ways of eating that have worked for some people, right? Based on their individual makeup, right? So that's why I said in the beginning that, you know, some people will try one of these diet theories and do amazing. And it's the thing that that's finally working for them. And other people are like, oh, I just felt sicker on that diet. So because, you know, they're not getting the things that they need. So what I help people understand is that there's foods that are inflammatory or unhelpful, and ingredients as well. There's a lot of toxic chemical ingredients that are put in packaged food. There's a lot of ingredients that are marketed as healthy when they're not. So that's what all the confusion is out there. It's like, and nobody knows what to eat because we're told so many different things about what's healthy and what's not healthy. But really, what I help people understand is like, these are the foods and ingredients that can be inflammatory for you or for other people, right? These are actual poisons that are in food. So understanding that there is actual toxicity chemicals in our food that we really want to avoid by reading labels. But also just understanding that fruits and vegetables, there's such a range, right? There's so many different colors. There's so many different varieties. And to your point, when you're traveling, you're going to get different varieties of fruits and vegetables that you may not get back home. So it's like, when you're in that environment, enjoy the fruits of whatever environment you're in, right? Or foods of whatever environment that you're in, because it's going to change based on where you're at in your life, what you're going through. Like, I've even talked to women that, ate differently before pregnancy, during pregnancy, and after pregnancies. They just felt like their body needed different things. And again, you said something else that made me think of a friend who's from Norway, and she thrives off the dairy, but she buys all of the Icelandic dairy, so dairy that's actually brought in from Europe. And she feels, I said, well, how do you feel when you eat that? And she's just like, I feel amazing. But she also grew up eating that, right? So like you're saying, it's like, what kind of foods did you grow up eating? Because those are foods that you probably still thrive on, if we're talking in the realm of whole foods.
All in moderation. But to your point, yeah, in neurolinguistic programming, we say there's a statement called "there's no failure, there's only feedback." So it's you can't fail with food, other than if you're deliberately eating things that are seriously toxic for you and not good for you. Then we want to work on that. But the sense of it's not, one diet in and of itself isn't going to be a pass or a fail. It's going to be, let's try it for a little while and see if it works. Because again, even with the gut, as you were saying, there's a delayed reaction. So sometimes I could eat something today, but my gut actually isn't reacting to it until about 2 or 3 days from now. But my mind is going to blame it on what I ate 2 or 3 days from now, rather than acknowledging that it's here. And that's where I think the journal can come in.
Exactly. Yes. So to answer the question, maybe a Mediterranean diet could be great for you if that's what's calling to you. From what I understand, they're into the healthy fats, the good healthy proteins, right? Lots of fruits and vegetables, I believe, or at least lots of vegetables. So yeah, if something's calling to you, try it. And then, if you take my program, you'll be able to make little tweaks like, oh, wow. For example, like a lot of people think canola oil is good for you because it's in everything. It's actually really inflammatory. It really destroys the lining in the gut. So if that's something that you're cooking with, you definitely want to swap out to coconut, avocado, olive oil. And when you're looking at packaged foods or even packaged dressings, right? Because we all need convenience. There's, and I suggest brands that I like. In fact, I'm going to have a show and tell portion of one of my classes where I show you all of my favorite products that are convenient. But they make dressings with avocado oil or olive oil so that you can have your convenience food and eat it too, and remove the inflammation from your from your diet.
Yes, and we have to entertain the child, right? As the therapist, I'll have to bring that in. But the concept of, if we make it pretty, that makes it more attractive to the brain, right? So, just like I might put the apples and different things in a particular design and make it look like a flower for my son, and like, oh, that actually makes me want to eat it now too, right? If we know how the brain works, we can trick the brain into having it be exciting. And so the rainbow, putting it in a fun design, and I know you were doing that in some of the pictures that you used in the handouts. But if we make it visually attractive to the brain, and again, as you were saying, the simplification, sometimes it's not about the food, it's about the sauce, right? Anyone can do anything if there's good dressing, right? So you've got really great recipes on dipping sauces and dressings and things like that. And that really just helps, it helps the inner child's brain, where it's like, I need something exciting and I want it fresh and I want it new. And it's like, okay.
I love that. And it's why, so like one of my favorite things to do is drink a green smoothie out of my wine glass, because I actually don't drink alcohol anymore, but I love having, or like a martini glass, like, yeah, like make it fun.
Yes. Yes. How do we make it fun? Because certainly, again, there's so much stress around eating. And even if we say, can we take one bite mindfully to really tune in? And not that we want to think about something stressful, but sometimes it can be helpful to say, okay, you know what, as I give myself this piece of food, can I really bring in gratitude, right? That power of gratitude, of thinking of all the people that are not getting a meal today, or that aren't, feeling just so abundant with the food that's so easy for me, right? I feel so blessed to be able to go, I've got food in my fridge, I've got food in my pantry. That moment of gratitude does a few things. One, it's just good for the brain. Two, it's really calm. It's one of the most calming vibrations and frequencies that's emitted from the heart that really calms down the vagus nerve, which allows the stomach to really, again, absorb and receive the food in a calmer way. There's a anxious stomach, right? If we're stressed and we're hurrying and we're moving and we're eating at the same time, and then we wonder why we have indigestion and bloating and things like that. So as you said, we could be eating perfectly, But if it's received in a way where it's hurried or rushed or doesn't feel fun or enjoyable, right? Oh, I'm eating this carrot. This is so boring, right? It's like, how am I supposed to do that? I don't want my body to receive it. So we're going over a ton of information, and I know listeners, you know, you and I are going back and forth, and but it's clear that we're passionate about what we do and that we love what we do. And so again, I think I'll just highlight your class starts next week. It's a 6-week class, and all nourishing foods, and it includes substitutions, right? What to eat instead, not just what not to eat, but it is what to eat, how to make it easy. You do these cooking demonstrations and show them not only how easy it is to make it, but how fast you can make it. You talk about the brain-gut connection in terms of how do we make it fun, how do we make it attractive, how do we calm the system and start to heal our emotional relationship with food. And then that really complements well with the My Retrain Your Pelvic Pain course, where they're really learning about the vagus nerve and learning about how it's all connected, and how in order to heal pain, we have to heal the brain. In order to heal the brain, we have to heal the gut. And so I think we're a great power couple, you and me, Monique.
Yeah.
And I'm very
I'm so excited to be a part of the team and to have this creative space to you know, share with what I'm passionate about. I'm super passionate about helping people heal their bodies through food.
Yes. And I think what would be great, and we didn't plan for this today, but maybe let's do another Instagram live, you know, in a few weeks or next month. But I think what would be awesome is to do a little cooking demonstration during Instagram live, and then I could talk people through a mindful eating on how to, you know, really enjoy what they just made. So maybe we can set that up for next month.
Oh, I love that. Now maybe everybody that's on here can give some feedback on what they like to see demonstrated.
Great idea. Yes. Comment below.
Yes, please. Fun. I'm in.
Well, thank you everyone for joining us today. Is there anything else that you would want to share today while we have people's attention?
Let's see. Oh, there will be another course coming up after this one. Well, we're creating a few more courses that will be even more gut specific, called Creating a Healthy Gut. So stay tuned, but definitely this course is going to be a foundational course. So I think it would be good to start there, especially if you're just so confused about what to eat. Just come to the classes. And then if you want more in-depth support, I'm available one-on-one.
And you're very comprehensive. It's both for male and female patients, and, you know, gender, non-binary gender, but everyone that has chronic pelvic and sexual pain may benefit. And you speak to specifically women with endo and how that kind of gets all wrapped in. But then you're also able to talk to men that want to, you know, talking about muscle mass and kind of wanting to build, or having a hard time because they can't exercise with pelvic pain, but they're still wanting to maintain that protein and muscle mass, but not constipated. So again, different needs, different people, different bodies, different, there's a lot of differences, but you're good at bridging the gap between what is the same for everybody, but also how to really discover what's different for each of us. And
exactly, because we're all different, and that's always been my philosophy. I meet people where they're at. It's, you know, because no one person is in the same place. Everyone has something a little bit different. Like you said, even different just challenge, like work challenges, or, you know, some people can't take a lunch, and then, you know, some people are like, oh, I love taking lunch, but I don't know what to eat when I go out to eat. So then it's like, let's talk about like what to eat when you're dining out. So it's like whatever you're working on. I mean, we'll have Q&A too. We'll leave some time at the end of the classes to answer any questions that come up, because I always like to remind people, like, definitely if you feel comfortable speaking up in a group, please do, because your question is likely going to be helpful. It's going to answer other people's questions, or someone else will be like, oh, I didn't think about that. So, but yes, sign up for my course.
will benefit everyone that takes my course.
Yes, exactly. And sign up for Dr. Milspaw's course too. And you can take them side by side. Now that would be really cool. We purposely did them on different days and different times so that you could, you know, take them all.
Yes. And we'll keep doing sneak peeks with the Instagram Live.
This is fun. Thank you.
Have a wonderful day, everyone. Thank you for joining us.